My name is Edward Roberts, and I'm here today representing a company called Bedfont Scientific Ltd. I am the product manager for a product called, or the product range of Smokalyzer, their breath carbon monoxide analyzers. Bedfont Scientific Ltd is a medtech company. It's been established now for over 48 years, and we are the world leaders in breath analysis in a medical setting. And we manufacture a range of devices, and that one of those being the smoking cessation range. And today we are joined by two special members of our medical advisory board to discuss World No Tobacco Day, which is a yearly event. It's a yearly event that's been established since 1987 by World Health Organization. And I think the key messages we wish to discuss today is really about understanding how marketing shape perceptions of tobacco and nicotine products, and especially amongst the youth, young people, and how can we respond through education, policy, and communication. So without further ado, I'd like to introduce you to our panel for this discussion today. So first, we have Dr. Amer Siddiq Nordin, and Amer is a consultant psychiatrist and smoking cessation specialist from Malaysia. Dr. Amer is involved with Quit Smoking Project with the Ministry of Health, where he has actually helped to develop, train and assist people across the country to quit smoking. And also joining us from Malaysia is Professor Dr. An Yi, who is a consultant psychiatrist, and her research is focused in nicotine addiction, particularly in smoking cessation. She's done a lot of innovative work looking at ways to assist people to quit smoking in Malaysia and globally, actually. So hello to you both. I think let's begin today's discussion. The first question I have for you actually is, has tobacco and nicotine marketing strategies evolved over the past decade, do you think? And particularly when reaching younger audiences?
Well, that's definitely right. So we see the shift from like a traditional to digital platform now. So last time we had televisions or radios, right? So now youngsters probably have a very like very right not really understanding how radio work now. So because they are been using social media platform quite aggressive. So Instagram, TikTok, YouTube, 小红书, right, to indirectly promote the tobacco and vape products now. So influencers, often without direct advertising the labels, showcase like vaping as a trendy or part of the youth culture. So these posts may not be formally labeled as like advertisements. Like last time, right, traditional advertisements, they were like they have the time slots, right, to advertise their product. But now, right, these influencers, they are not really like formally labels, right, the products they are advertising. In fact, right, they actually make the promotions embedded in their content. So the influencers may actually demonstrate like a vape tricks, unbox like a new flavors or subtle kind of including like a vaping device in their content, making it seems like a normal and accepted right part of the youth identity. So this kind of exposures, I would say that's right. It demonstrates perception that vaping is fashionable, social, and risk-free. So contributing is appear among the adolescents who are highly impressionable and influenced by the peer validations. So this kind of advertisements is much more powerful than our old traditional advertising. Yeah.
No, I fully agree with you, and I think yeah, you've brought up some really interesting points. Personally, I didn't think about it in that way. I do know that with regards to advertising and marketing, things have advanced over the many years. You're right, it's moved from traditional to non-traditional. But you're also right in terms of the duration that you can now advertise, which is literally 24/7 and not bounded by locality. It's global. And therefore,
Yes.
there's just a lot of opportunity for individuals to be exposed to things that they might not necessarily know about in their country because of this global appeal. And I also agree with you that the role of individuals or organizations or associations that might have an interest in certain areas, like the issue that we're discussing, which is cigarettes and probably electronic cigarettes, um, can definitely be appealing, especially when you're using micro influencers, people who just feel the same as most of us. And I think
Yeah,
based on certain research in marketing, these these type of influencing activities definitely increase appeal towards certain populations in our community, particularly young people. Especially when you add on things like certain words like flavors, certain colors, certain appealing, maybe
Mm.
jingles, or maybe shapes that
yeah,
might be much
Yeah.
associated
Uh,
with
yeah,
what you like. So it sort
yeah,
of
because yeah, because it downplay the perceived harms, isn't it? Right. So especially they give a flavor names like bubble gums or like
mm,
unicorns, like mango or grapes. Like the adolescents or like youth, right? They will think that this is healthy. This is like harmless for them. Yeah.
So in a way, we are renormalizing, unfortunately,
Yes.
tobacco products in a different way, in a different era.
Mm-hmm.
And I think it goes back to your question, Edward. So
mm,
the answer would be yes, marketing still plays a huge role. Yes,
mm.
there is a lot of challenges that we're facing when we're dealing with tobacco-related marketing out there in the community.
Yep. And now, try to actually the way that the marketing is much more persuasive than traditional advertisements, and it's also harder to regulate or restrict them because there's like sort of like a very subtle marketings, and then it's embedded in their content. So it is very hard to regulate.
Yeah.
Yeah, the regulating bodies, they need to watch every single right content in order to decide right whether this content should be actually out there for the adolescents or youth, which is not possible to do it.
Yeah.
Okay. Yeah, sure. Yeah, and connection, I guess, is my next question. About nicotine products, which is placed near confectionery items in a retail environment. So, what factors do you think drive decisions about product placements like this?
Well, I think definitely it plays a huge role. There's lots of available research to suggest that placing items like this in areas where um, is more appealing appears to, as we discussed this on, renormalize a little bit the harmful product. Um, Especially in our country, sadly, there is a situation whereby certain types of tobacco products, which includes electronic cigarettes and other items that have certain appeal, could be placed in areas where young people could actually be seeing them, probably at eyesight. And there's data to suggest as well from research that young people observe these more than we think that they do.
Mm,
Therefore, there are regulations in certain countries where you can't be putting items like this in the eyesight of where young people can actually see, or in areas where young people are actually present, i.e., near schools or learning facilities. So the main reason is that because we want to reduce the appeal,
Mm,
and for those, for those who might still want to use them in the adult population, although most of us would advocate you to continue stopping, then definitely they would be very specialized for those individuals. We definitely don't want them to be put in areas where the whole population in that community will be able to see them, including very young people who do not yet understand the full
mm,
extent of what they're dealing with when they are using those particular products. Hopefully never, but if they do use, they might not understand why and what's going to
mm.
happen when they do.
Yeah. Well, I fully agree with Dr. Amel's point of view. And the reason why they put that is also try to say, understand how our brain work.
Mm,
Because both sugars and nicotines basically stimulate the brain's reward system, the same area. So placing them together may amplify the cravings and impulsive purchase, especially among youth, right? So food is strongly tied to pleasure and rewards. Well, for many countries, well, for Malaysia, it's food is actually is the most rewarding, well, it's items, right? So it's really strongly tied to the pleasure. So nicotine products placed near the sweets, right, may subconsciously link link together smokings
mm,
with the similar, gratifications that the food can bring to them. I have
right.
actually done a studies, validating the Malay versions of the Fangostorm test for nicotine dependence. I
Hmm.
actually found that, there's one uh, questions was asking, what will be the people who smokes, they hate to or hardest, to give up the most, right? So which cigarettes they found it, hardest to give up the most. So the answer, there will be two kind of options. One is in the morning, and the other one is other times. So virtually most of my Malaysian smokers, they actually choose B because they found it the hardest to give up cigarettes was actually the one that after meals, not in the morning. So this actually support the
Mm.
idea that food following by smoking create a very powerful reward loop via the dopamine release in our culture. And that is why, our cigarettes company fight for a place to put their products near the eatery places.
Think, yeah, I see the accessibility as well. And if you think about it, maybe, even at schools, I guess, when children are going for their breaks, they're going to the sweet shop, that's the first place they go. They all amalgamate together there, and they have
Exactly.
everything there. They have the food, and if they want to replenish or, replace their vape, that's the perfect opportunity to do so. It's that accessibility as well, isn't it?
Mm, definitely.
Yep.
So it's but of course, like Dr. Amir say, the visual proximities of the food and nicotine products
Visual. Yeah.
definitely will blur the boundaries between consumables and control item.
Mm.
The brain will think that nicotine is also as harmless or even is unnecessary as food. Okay, so
Yeah.
that also potentially reducing the stigmas and normalizing the nicotine use. Yeah. So last time, now I still see it, but then ever since we have this tobacco act that's implemented last year, I see less of it. But then last time I saw people after food, they will straightway smoke in the eatery at the eatery place.
Yeah.
Yeah. Despite there is a huge sticker on sticking on that at the eatery place say that cannot smoke.
Do they smoke in the eatery place as well, or
Yes,
are there sanctions or restrictions there? No, they're allowed to smoke in the building as well, where in the eatery itself.
they are not allowed. In
No.
fact, 3 meters
Okay.
away from the eatery place, you are not supposed to smoke.
Uh,
But they will just smoke.
but yeah, they're not going to listen. No. Yeah.
Yeah, right. Well, yeah.
Well,
So, Dr. Amir, do you want to add more on
yeah, I
this?
think definitely, Edward, to your
Mhm.
question, times have changed.
Yep.
So we can't smoke inside the building itself,
Yep.
but if the restaurant has an al fresco,
Okay.
uh, theoretically you're not supposed to smoke there too because it's still part of the eatery. And often this is where people do. So they don't smoke within the building itself, but
Right.
within the boundaries of that particular restaurant. But the Tobacco Control Act that was approved last year, uh, forbids you from actually smoking within a certain uh, distance
Boundaries.
from,
Yeah.
yeah, from the eatery space, and therefore, as Prof. Ann had mentioned, you get less individuals now
Mhm.
that are seeing
That's
that
good.
are smoking within that compared to before. But definitely, we would love it to be even more so.
Yes, it's still close.
Yeah, there's none at all. But
Yeah.
things are, I think, moving for the positive. It's been about 6 months since we really enforced some of these control acts, and we're seeing less and less individuals.
Mhm.
In fact, just now I was just passing by for lunch, and people are smoking a little bit further away in this neighborhood, which is definitely not, like I said, something that we would like to see. We would like everybody to be quitting, but at
Mhm.
least people are starting slowly to get it into them that they can't smoke within that particular parameter.
I mean, my next question, I guess it all connects, and I think we have touched on that. I don't know if you want to expand, but in your experience, how might the proximity of nicotine partners in the sweet shop affect the young smokers themselves?
Yeah, I think going back to that, like I said, there's definitely a lot of research to suggest that
Yeah.
the closer that places are that provide tobacco products, the more likely that young people who are within that vicinity will be at risk of consuming those particular products. So there
Hmm.
are a number of legislations in certain countries, like New Zealand, for example, where you're not
Hmm.
allowed to sell tobacco products within a certain distance from a teaching or learning environment, or where
It's
children are
really good.
bound to be found, like a nursery, for example. We tried to introduce as well when we proposed for the Generation Endgame. So apart from not allowing individuals born in a certain year to be smoking or using tobacco products, it was also as part of the whole policy. We wanted to ensure that certain areas only are where you can actually buy tobacco products, so it's highly regulated. Only adults of age can actually go inside and decide to consume. Young people who have never smoked probably will never be able to see a cigarette. If they did, they probably won't be
Mm.
able to purchase because it's at a very highly regulated environment. So there, I mean, the fact that we proposed this is not just because we wanted to make it difficult, because the research does suggest that if you
Mm.
are able to restrict the areas where people are able to purchase, or where young people are able to see these items, you'll get less people actually using, and as a result of that, you
Mm.
might drop the initiating factor of cigarettes or tobacco products, whereby young people won't start to initiate. And as we know, the younger that you initiate, the more likely that you're
Mm.
going to be a more difficult to quit smoker. So the later that you initiate, the more likely that it's going to be much easier for you to
No.
stop. But at the same time, the later that you initiate, like say for example, if all of us here decide to initiate at our ages, it's very unlikely that we might even decide to, because we're just more aware about the harms, and it's just not worth it. So in a way, you're killing two birds with one stone. You're reducing
Mm.
people from starting this particular addiction, or the
Mm.
journey of this addiction. And more importantly, if they were, for whatever reason, experimenting, they're more likely not to continue that particular journey, and hopefully be able to quit much easier.
Yes. Yeah. I think right. That is a very good regulations, right? If you make them to have difficulties to, right, purchase the products, right, we might actually delay that initiating, right, part to, right,
No.
take up tobacco products. Yeah. So I think another things that we should look at is like, right, the prohibitions of these, right, any chances for the promotions and advertisings, right, for the tobacco products. So one of it, right, is plain packagings and display bans. In Australia, right, the tobacco products must be sold in a plain brown packaging with no blending,
Hmm.
and retail display of tobacco is banned and products are hidden from the view. I came from Thailand. I found that, right, they actually use these, right, A4 paper to cover these right places like they sell tobacco products. So and also the graphic health warnings on the packaging mandatory and should be right more should be occupied larger right percentage of the areas right of the packaging. And also right I think the pictures, the health warnings, right? Graphic pictures should change from time to times, right? Otherwise, right, people will get sensitized. I mean, desensitized with like those pictures. That's why, right, encourage and suggest, right, we should actually change the graphic health warnings, right, from time to time because people kind of like desensitize it. Yeah.
Okay.
If can have a plain packaging, that would be the even best way of like doing it.
Yeah. I think that has happened in some countries. We do, have that in the UK. We've had for some time now. They did remove the graphics and things from the packaging, which I think it kind of there are two knock-on effects of that. I think. I mean, one, I guess, it's quite difficult actually now to work out what packaging is because it's all the same packaging now.
Yeah.
So even the label, it's difficult to which brand you're
Yeah.
picking now as well. But their messages were always a funny one because they were really quite intense, weren't they? Those graphics and sort of thing, um, and it's funny people are given, smokers. It's a funny addiction because they're told by the manufacturers don't smoke because this is the damage that's going to cause. Over time, these are the risks that you're taking, but it just goes to prove how strong of an addiction it is smoking. I think because no matter how many times you're told and it's in front of your face, um, people are just not going to quit. It's just grabbed a hold of them. That tobacco use.
That's so true. I think one of the other reasons is because you're getting delayed
Yeah,
effect.
yeah,
Often you're getting the positive effect much earlier compared to the problems of smoking. When you brought up the fact that it might be
mm,
difficult, I was doing my PhD during the time when they were introducing plain packaging in Australia as the first country to do so. And I remember one of the arguments that we gave for it to happen is that young people who have never been exposed to cigarette smoking will not be able to connect to brands. And I think
yeah,
your
yeah.
experience of just getting confused and if you wanted to buy something,
Yeah.
whether it's A, B, C, or D, it doesn't make any difference to you if you've never
No,
known what A, B, C, or D looks like.
yeah.
For older people, they might be very connected to A or B or C or D.
Hmm.
But for maybe young people, when they come up and suddenly of age and they decide they want to smoke, they
Hmm.
go into a shop and then you're given a list of A, B, C, or D. It
Yeah.
doesn't really matter which one you take. You're probably looking at things like
No.
price point. Price
Yeah.
point is probably the only
Yeah.
thing to be because there's nothing else to connect you
Mm,
with a brand.
yeah.
I think that was the whole objective that we
Mhm.
were looking for. And it looks like from what you're just experiencing and sharing, that objective has been met.
It has.
So the companies, of course, uh, like in Malaysia, for example, where we haven't gotten plain packaging yet, they try
Hmm.
very hard to connect the brand to a certain taste and feel. And as I
Hmm.
understand it now, we used to connect it with a name. So, Edward, Amer, Anne. But
Yeah.
now we're just trying to connect it. And then at one point they tried to connect it with like an alphabet.
Hmm.
So
Yeah.
ASAN, E.
Hmm.
And then now they're just connecting with maybe a color because they're just trying to make it as simplified because they know that I think as we move forward, more and more countries will start to be, plain packaging because as
Hmm.
you've rightly mentioned, UK has started it, Singapore
Yes.
has, Thailand
Yeah.
has as well.
Yeah.
Australia had always had it. New
Hmm.
Zealand, I think, has it as well. So it's just going to be a norm at some point. At some point, you're going to lose that appeal for the countries that keep on introducing more and more legislations. Even like ours, we're pushing that to forward. So you got to connect it quickly now before there's no more connection. Because at some point of time, there's not going to be any more connection, and it's going to be very hard to win market share within an environment because there's just really nothing to connect you apart from price point.
Yeah. It's almost like a bit of a shift, isn't it, Amer? Because and they're doing the right things with that tobacco because, as you say, eventually there's not going to be so much, want for those sort of things, and but it's almost like that. But we're promoting in other ways the vaping, so it's almost like it's false. It's a forced approach to, eradicating or removing tobacco use. But
Mm,
guess what, everyone, if you want to smoke, there's an alternative for you, and it's a safer option, children. And look, you can get different flavors and colors, and yeah, it's
In fact,
yep.
you've really stirred the
sorry,
hornet's nest, Edward, because
sorry. Yeah.
no, because I mean what
Yeah.
you said is truly rightly as well. Because as we move towards plain packaging and you can't connect with the
Mm,
people,
yeah.
um, we know that many bigger organizations are buying up
Hmm.
smaller electronic cigarette
Yeah.
companies. We know that it's already documented.
Yeah.
Electronic cigarette space is very fluid. The regulation is a little bit more challenging compared to
Hmm.
tobacco products because you've got big players and small players and independent players. And as a result of that, what you lost in the cigarette area, you're now gaining or
Yeah.
regaining back in the electronic cigarette, and not only electronic cigarette, but non more innovative tobacco products. Whether it
Hmm.
might be, say, for example, smokeless tobacco products that which are now in various shapes and sizes. And more recently, there is like I think in the US pouches that have come up, which is going to be a bit more popular. Which in a way, it's a bit harder to regulate because if you did not do a policy that is overarching, you're going to have to start discussing individual components because a
Mm,
cigarette is a certain shape in a certain way. Electronic
mhm,
cigarette is different. You can't say it's a cigarette sometimes because it looks
mm,
totally
yep,
different. And what about these other new innovative stuff that we don't even know what's happening? So unless you
yep.
have a policy that is like
Hmm.
anything that is, I don't know, has nicotine and tobacco in it, then you need to regulate it.
Yeah.
Then it's a
Mhm.
little bit easier compared to just saying a cigarette because now the cigarettes don't look like a cigarette anymore.
My last question, I guess, on product placement in itself, globally, and I think we have touched on this previously, but it's about policies and examples of policies globally that have been effectively addressing the concerns around the placement and visibility of nicotine products in stores. So I think we have talked quite a lot about that at the moment. Do we have anything else which to expand on that question?
Uh,
Right. So I think, right, because now they can market online.
Mhm.
So we do have to have you know, enforcements, a strong enforcements, right, to regulate that part. Right. Because although they say that, right, they are not selling, right, any products for those who are under 18. However, right, there is not a strong, right, monitoring or regulations. So we should actually have a age gate online and retails access with a strong like enforcement. So requires like a strict, you know, verifications for purchase, right? Both in right physical stores and like online stores, right? Penalties for
Mm.
non-compliance must be actually substantial and enforced. Right, there should be the algorithms and policies, right, to detect and remove, right, any like those hanky pinkies kind of like marketing to
Mhm.
youth. Right, so the paid influencers also have the responsibilities, right, to right, at least we should monitor them, right, so that they have that responsibilities, right, to be
Mm.
like transparent, right, labels and like or right, age restricted, right, when they are selling their products. I think, right, we have to like have that implement.
Yeah, I fully agree. I think we are definitely struggling a little bit on this area. And I suspect that globally also colleagues are also
Yep.
finding new challenges. Like I said, it's almost borderless now, especially when it's online.
Mm.
And, uh, what works, what is regulated in one country is not regulated in another, yet we get the content, vice versa. So I mean, easily put, Edward, we see some of your the shows that you're watching, like, if you're watching Downtown Abbey, for example, if
Mhm.
you are, it's available here too, so
Mhm.
sometimes if that country doesn't have strong tobacco control laws like ours in the past, then if you're watching certain films or
Mhm.
shows from outside, there might be product placement that is not allowed in your country, but you're exposed to it because it's allowed in, say, our country. So these are the
Mhm.
kind of things that we have to think, because they've got a whole group of people thinking about this. So even for the tobacco control policy makers, you've got to also think like this as well in order for you to be able to protect the people that you're trying to protect within your jurisdiction.
Oh,
Agree.
well, thanks for opening my mind to that. Yeah, we don't see, as you quite rightfully said, some things that might be, regulated here in different countries, sides of the globe to the rest. And so, I'm unaware of some of these things. There's always something new to learn. So, no, thanks. I didn't realise that was the case. I thought, it was something that might be controlled globally. Uh, the marketing or the using of a brand or a product on television. Itself. I thought, you think you must have permission for everything. Everything in some
Yeah.
certain areas of the world must have permission. But I think I want to kind of move on to a bit of more education sort of section of the discussion. And
Yeah,
this one's about
definitely.
initiatives. Yeah. So what initiatives do you believe offer the best model for achieving smoke-free goals by addressing youth targeted marketing?
Right. Of course, right. The the youngsters, right? We have to try to educate them so that they can understand and then try to can make the right decisions. So we often try to found that if the public health campaigns, if it start very much early and it becomes one of their habits, right? So that will be much easier, right? To prevent them, right? To get into to make a wrong decisions. So one of the example will be brushing teeth. I'm not sure, right? In Malaysia, right, the dentists will come to the school and then
Hmm.
will teach us how to brush the teeth. So it's
Yeah.
and of course, right, it became a habit. So we all have
Mm.
this habits after meal we will brush our teeth and all that. So it probably will reduce the cavities of our teeth lah. I hope so. Right. So if we actually have a campaigns to engage the young people when they are very young, right? So I'm talking about when they are children and all that, right? It definitely is right. Will try to help them to make a right choice. Although when they become, I mean, once they're over 18, of
Hmm.
course they can make any choice they want.
Hmm.
But
Yeah.
with these habits, I hope that they will make right decisions.
Hmm.
So we probably, inside the educations, we can actually deglamorize the nicotine use,
Hmm.
right? Because kids, they always want to become adult, and then they
Yes.
see it, they see adults, right? The only way to turn adult is like they could actually smoke. So we do
Yes.
have to try to degramarize that kind of a manhood for them, right? So we have to try to portray smoking as outdated is actually a manipulated behaviors.
Hmm.
So it is no longer trendy. So try to hope that they can actually try to avoid the
Yeah.
products.
Yeah.
Yeah, and
I thought
also
it's yeah.
yeah, yes, and
Yeah.
also properly it's also empower them to
Hmm.
tell them that they can actually control and confidently make a right choice, right? Instead of
Yeah.
under the peer pressure. So the peer pressures,
Mm.
they will. They find that they cannot say no to their friends, and that's how they
Hmm.
get into smoking. So we
Hmm.
have to empower them. That's right. So you can say no, right? And inform the choices, right? Rather than
Hmm.
they act, right?
Hmm.
Because they fear losing out from the peers and all that.
Think
Yeah.
Prof. Ann had actually mentioned a number of strategies, but I
Mm,
think what's
yeah.
more important is to have them all happening at the same time. So it's not only just the young people that we are targeting, but the
Mm,
teachers that
mhm,
are teaching them, and also probably the parents that are parenting them as well. So in Malaysia, we have this, and at least in our team, we have this group called Hebat, which is doing advocacy among young people.
mhm,
And the latest one that I went with, well, myself and Prof. Ann, we went to Maldives to run this course with Maldivian children. And what I noticed that the appeal is the same as when we do it with Malaysian children.
mhm,
So number one is really about sharing with them about these products that are available so that they're aware of what they are and why they shouldn't be participating in them.
mhm,
Second, as you've rightly mentioned, to connect the consequences to something a little bit more youth friendly, like
mhm,
friendship, appearance,
mhm,
maybe about masculinity or femininity, depending on what. So it's very targeted, as you rightly mentioned,
mm,
but also at the same time to explain to these
mhm,
young people why we are doing this program. In the past, we've got, to be
mm,
fair, even in Malaysia or Asians, we have a very paternalistic, maternalistic view that we tell these young people what to do. The
mm,
collaborative view, I think, is a little bit more helpful and useful. And
Mm,
data seems to suggest that young people, just as they are looking at more things than we think they are, they understand more things than we think they do understand as well. So
mm,
having programs that are more collaborative in nature appear to be more successful.
mm,
And if you get it like Prof. Ann
mm,
had mentioned, like in a peer kind of way, then among the peers, they will I wouldn't say they are telling out their friend, but they're assisting their friend more. They'll say like, Edward is
mhm,
using, why don't you tell Edward that he shouldn't use? So in a way, for us, we identified one person that's using, but because they made it in such a manner, then we can say, well, you know, what are you using and why are you using it? It's
mm,
as we shared just now, it's a good thing. Maybe all the
mhm,
friends here can help in making sure that so and so doesn't use anymore. So
mhm,
that's a way for us to connect, and I think that's the better way than what we used to have in the past, which is punitive, right? Amir,
yeah.
you're using, come here.
yeah.
So automatically
Yes.
it's very scary in that sense. And
Yeah.
it's not going to be helpful. People are going to make fun of you, in fact, because of that, which doesn't help
Yeah.
the esteem of that young person when they're trying to, because they don't understand why
Mm,
what's wrong and why they did wrong. But through this new mechanism that we've noticed, it works across the board. So I think that there's a multi-pronged approach affecting multiple stakeholders and a more collaborative approach moving into
mm.
2025, I guess.
So, how do you think public health campaigns effectively engage young people itself while minimizing the risk of sparking curiosity or encouraging experimentation with tobacco and nicotine products?
Mm,
I think there's
well,
some data to suggest that you definitely don't want to be product placing stuff for children.
mhm,
But there are also research to suggest that explaining about the various reasons why these products should not be consumed appears to be more appealing. So on a
mm,
public health point of view, of course, we're looking at a population
Mm,
approach. And therefore the campaigns that we're having needs to be youth friendly with a youth voice, with probably youth lived experience, not you and me lived experience, because we're
mm,
not living the kind of life that they're living. So
mm,
one of the example that's been very successful has been the Truth campaign in the US, or
mm,
Tobacco Free Kids campaign in the US as well, where they've really used a lot of young people's voices, statements,
mm,
actors to
mhm,
actually get other youth to disengage from using tobacco products. And like I said, when we did our
mm,
program in Malaysia, with you. So what we did also is that we got ambassadors among the university student population, which is very close to the age of the young people that we're targeting as well.
mhm,
And we noticed that they connect more to their elder peers compared to the lecturers like us. So this has also been found to be quite helpful and successful in other campaigns done globally, apart from what we've done locally as well.
Yep, right. So like just to a bit of add-on, so what Dr. Amer said just now, so, we could actually involve the young people, or well, we should involve young people in designing all these campaigns, right? So to ensure the relevance and authenticity. Involve these young people, because they're living in the world that right, so different from what we live
Yeah.
last time. So right, they will know what kind of the language, or right, they can try to tell their peers, and then so what kind of experiences right they can share with their peers. So I think that will be much more impactful, and of course also to just now I have already mentioned is to empower them, right, to make the right decisions, also encourage dialogues rather than just awareness. So well, right, they will lead the discussions in the classrooms or among the peer groups. Let them to debate and reflect.
I think now, I guess looking at breath CO devices actually now, which are proven for many years, since 1976 actually, when Bedfont first manufactured our breath CO devices, proven to be useful in smoke cessation efforts actually. But how effective do you think objective measures like CO monitoring are in helping individuals actually, particularly young people, understand the immediate effects of tobacco use? So connecting CO monitoring to the tobacco use.
Well, I think my personal experience has been young people are sometimes quite skeptical. So when you're able to show them objectively if they're smoking, that the smoking has direct harm to them through the monitoring of the carbon monoxide, it does send a bit of a signal that this is real. Because like we mentioned just now, when we're talking about heart disease, it's something that won't happen to them or might not happen to them for like say 30 years. But the carbon monoxide monitoring actually objectively shows individuals, including young people, that whatever they're taking in compared to their peers are not taking is different. So sometimes when you're able to show, okay, what about this friend not smoking zero, and this you who are caught smoking and your numbers are like 40 or something, then definitely you say, look, there's something in that device, that the product that you've just taken that's caused this harm, right? So for some people, this might be that first realization that what they're doing could potentially be harmful to them because they're actually objectively able to see what's happening in their lungs. The other thing, of course, is it creates a level of a dissonance, that unease, that, oh my God, that means there might be something really going on with me. And therefore, this might be that little bit of a trigger for motivation to get people to consider quitting. So I think the device that we have definitely is quite helpful. The device that we're having right now, the many types that you guys are producing definitely helps because some of it is color coded, which makes it easier for those who might not be very good with numbers. Some of them are more personal compared to others, so there's that bit of element of innovativeness that some young people like. But I think what's more importantly is it engages the person with us in a conversation about why it's harmful for them to continue this particular activity they're doing, which is smoking in this case. And hopefully that might be that first trigger point for them to consider quitting. Now, more importantly, when they're starting on their journey of quitting, they'll see that number reduce. So this also motivates them and gives them us some credibility when we say, hey, look, you've stopped smoking and now you can see that your numbers are actually improving, which means that your lung health is improving. And there's a lot of videos online now that you can actually see lungs of smokers versus lungs of non-smokers, which they can then connect. So before this, they will say, it's not my lung, but now you're showing them data to suggest that, yeah, it's not your lung in the video, but definitely this is how your lung might look like because your numbers are such with this real-time monitor that you're using. And when you quit, as we promised you, your numbers will drop over time. And the longer that you're able to maintain this, the better for your lung health And if you've just started it, then definitely there's an element for you to be cured in a way. But if you continue using, i.e.,
Hmm.
smoking, then this number will persistently be high, and we can prove it to you. You can come every week, and you'll see the numbers will never go down.
Hmm.
And you can see this video that this person
Hmm.
of 10 years, 5 years,
Yep.
20 years of smoking, and this is how the autopsy of the lung is. That's going to be your lung. And sometimes this, I feel, allows them to connect. Because you have to remember, Edward, when we're dealing
Mm.
with quit smoking for children or young people, we can only use behavioral support as the
Hmm.
mainstay. So to connect with them on that element is quite helpful when you have something objective for them to see. If
Yeah.
not, it's just a lot of chit chat that you're having with the young person, and they might not necessarily be able to visualize. And like I said, if you show them a video, that's not my lung
Yeah.
Yes.
because no proof
No, I
that my lung.
see. Yeah.
Yeah. So now you're
Yes.
saying that, well, this is Anne who's never smoked. It's
Hmm.
0, as we can see this young pink lung, and this
Hmm.
is your lung. You just caught smoking behind, and it's 40. This is somebody who says that they just smoked, and we know that the brain gets saturated. So definitely, this is going to be quite helpful for us to help young people, and for young people to hopefully be able to connect with us in their quit smoking journey if they happen to be smoking at such a young age.
Mm. So
Yep.
there's not, yeah. There's not really. I guess as you pointed out, it's measurable, isn't it? It's something that's measurable, and I don't think there are many other devices or products out there that can show the damage, the actual damage to
Well,
a child or an adult is there from smoking. I guess carbon monoxide is quick and easy
Yeah,
yes,
to
yes.
perform. Yeah,
And it offer a real-time data.
yeah.
yep,
So right to that person's. So it's kind of like a on-the-spot
Mm,
evidence. So
right.
rather than just like talkings and right, showing them the pictures, they will say that right, it's not their lungs, right. What youth do the best is like right, they're always very defensive, and they also think that they are invincible. So they will be like thinking like I'm invincible, so that's
Yeah.
not my lung, right? That is like a 40-year-old man's lungs. Right. So right, with this objective measure, they can see the numbers actually will reduce their right defensiveness and denial. So they cannot deny, right?
Hmm.
The carbon monoxide, right? Smokerizers show your level is this.
Yeah.
So right, so it's like a caught on spot kind of things, right?
I see.
Then you would tell them, right? Right, to shift instead of saying that smoking is harmful, we like Dr. Amil say that right, we actually can shift the
Mm-hmm.
conversations, right, from right, well, smoking is harmful to you, to look, this is what is in your lungs like now. So you will have
Mm-hmm.
to switch right side
Mm-hmm.
responsibility from the external advice to actually an internal awareness. So they create well, I think like dilemmas or right concerns or disbelief inside them. Only
yeah.
then right it can trigger uh internal reflections. Then it can lead to actions. So we can much more easy to right convince them right they had to do something.
I think the other thing,
Otherwise, right, right, because your figure says so. Rather than right, right, showing them the pamphlets or lectures and all that, right? Well, they're not going to pay attention to you.
I know what you're saying. It sounds like I'm getting an image here of everything. We've got pictures. We tell these people that there's thousands of chemicals in these cigarettes. We show them detailed images, scary images of damage it could do. You show them like that's not enough. Sometimes, as you
No,
quite
no,
rightly
no,
put,
right.
yeah.
It will not
Sometimes,
matter
yeah,
because
yeah,
right, they will say that, like Dr. Amir say that, right, it's not mine.
yeah,
Right. You say that is like other people lungs, not mine. So,
mm,
but if you have
yeah,
this numbers to
hmm,
show them that right,
hmm,
right, so with your carbon monoxide level,
hmm,
this feature that I show you could be
hmm,
your lung now,
yep,
yeah, yeah.
right?
I think the other thing that we forgot is that or we have to remember that as you are normally when we do these kind of activities like we did the ones in Malaysia among young people, we don't do it in isolation, Edward. We do it in a group
Yeah.
of people,
You're right.
right? And often even in an adult setting for training, when we do training with the smokalizer also, we use it in an adult setting. It's just the impact for adults is different because we've
Mhm.
individualized our health a lot more. So it's
Mm.
more of little Edward has been caught smoking, naughty naughty,
Yes.
when we are doing it among peers, adults. But for young people, when little Johnny is using it and he happens to be a positive, and we're just trying to demonstrate to little Johnny that the impact of his actions have consequences. It also sends a ripple in the group of people who are watching this conversation happening. So if your narrative is such like we mentioned that, oh, little Johnny, you said just now that it's not you. Well, the numbers don't say so. But little Alice, little Asma, little Ben around the room is seeing, oh
Mm.
my God, my lung is zero and I want to keep it that way because if I accidentally use these products, uh, it's going to be that number. And maybe some of them might be thinking, oh, that's what my mom said, don't use them. That's what my dad
Mm.
said, don't use them. So in a way, you've not only helped the person who's using to consider
Mhm.
quitting, but you've also prevented, hopefully, the people around him to not start because
Yep.
they also have been part of that conversation of when you're trying to advise them. So
Mm.
that's another opportunity I think that sometimes
Mm.
can happen
Mm.
with young people, especially in if you've got a more positive slant in the way that you want to help them to quit. Of course, if they're caught smoking in the corridor, they're sent to the discipline teacher's room and then sent to the counselor's room for quit smoking is a totally different beast
Mm.
altogether. But if
Yeah.
it's for educational purposes, there is an
Mm.
opportunity where other people around them will then be saying, "Hey, I don't want to be this person," and that's what you do when you do start using, and I don't want to make that happen to me. So that might be an opportunity for people to prevent from using.
Mm.
Yeah. Really good methods. Yeah. Right. Do you have anything else to add to that? Sorry, Anne. Oh,
Well, it's
yes, sure. Yeah.
not that
Yeah,
like
sure.
I
Yeah.
think we have discussed
Hmm.
every
Yeah.
benefits that the carbon monoxide smokelizers can be
Hmm.
used for to prevent people to start smoking.
Hmm.
If there's smoke, actually will encourage them to stop. If they're trying to stop, it could also use to as a biofeedback for them to continue to stop smoking. Yeah. So I found that smokelizers is a very good tool in every stage of smoking smoking behavior. So it's from these preventions to
Hmm.
quittings and to maintain
Oh.
the abstinence. Yeah.
Oh.
So
Oh.
it will reinforce the behavior change. Yeah.
Oh, I see. So you're talking about, pre and also maybe, after the quitting
Yes.
as well, maybe. So you're saying maybe use a carbon monoxide monitor even after you've successfully quitted, maybe even as well to
Yes.
see that your carbon monoxide is. I guess that's good. Some good points. Yeah.
Yep. To
Oh,
reinforce this
yeah, of
abstinence.
course. Yeah.
Yeah, so my smokers, they will be very proud and
That's
say
yeah.
that, do you know my carbon monoxide is
Hmm.
less than two, and
Yeah.
from 40, and today is less
Sure.
than two. Yeah,
Oh,
so I
that's
can actually also take that opportunity to reinforce that behavior.
That's
Uh,
true.
so
That's
I
what
will
we
tell
do.
them that yes, you can do it. It's not like you cannot do it. So you can do it, and you have succeed, and we just need to continue.
If I sorry, I don't want to interject too much, but I think if I think about carbon monoxide as well, I think about pollution and things like that as well. And I think no one wants carbon monoxide. It's a poisonous gas. They called it the silent killer for a reason because it doesn't have a smell or a visual. But
Yep.
um, no, you don't want more, and you're directly, when you're burning of a tobacco and you're inhaling that, you're indirectly inhaling all of that carbon monoxide that you're burning.
Yes.
And just
Yes.
thinking more on it, yeah, carbon monoxide itself is, it's really, as you say, it's quite rightfully so a
Yeah.
handy tool to monitor, even if you aren't smoking, and even if you aren't in the path of or pathway of going through the quitting process.
I know that Bedfont actually have a new device. It's just like a smokalizer that can detect this like the fetus and the mother's
Yes.
right carbon monoxide. I think it's a fantastic idea.
Yeah, I was going to touch on that actually. No,
Yep.
whilst while you discussing the indirect and direct measurements, and yeah, we can actually measure the amount of carbon monoxide which is in the fetus, the baby that the mother to be is carrying, how much is in their blood, the percentage carbox of hemoglobin, which is an extremely powerful tool. And as you quite rightfully so, I think it's about being unaware of the effects as well. Some people can be a bit naive, I think, as well. They're smoking before the pregnancy. They don't want to listen to the advice they're given about the damages it can cause a baby and what the risks are, and the adverse effects can be
Mhm.
following birth. But as you quite rightly put, this is a measuring tool now that you can be shown the actual numbers, not even just directly from yourself, exhaling into that machine as the pregnant woman. But you're damaging your baby, and here's the proof. Here's the numbers that your baby actually has, of carbon
Mm,
monoxide in their blood because of you. And
mm,
yeah, and it's backed up by science, the numbers and things like that. And it is something that is taken very well globally, especially in the UK, in some areas of the globe, in hospital settings, it's used as well, for secondary care measurements as well. If I speak of the UK,
Mhm.
in secondary care, that anyone going through that maternity pathway is important or encouraged to do a breast CO monitor, but then also the father to be is also expected as well.
Oh,
Because he could be smoking himself, and again, they're connecting now. Um, Either way, each side, the secondhand smoking, you know,
mhm. Yeah.
so that's used there as well. Yeah.
Mhm.
Really encouraging. And actually, the more I think about it, I think there are other settings as well where the carbon monoxide monitor really could be quite handy. Because I think as well in respiratory, if you think about respiratory and things, and you go to see a doctor, sometimes I think the first question should be asked really if you have a respiratory condition or anything so is, do you smoke? And then you should be encouraged to quit smoking and maybe go on a smoker cessation pathway. But also dentistry as well. I've seen some areas of the globe actually putting our carbon monoxide monitors in dentistry,
yeah.
which of course
Oh,
will
yes.
support, yeah, which can also support and
Mm,
encourage patients to quit smoking for their oral health. So there are lots of directions and ways in which you can use and utilize breath CO monitoring, I think. Um, and I think it's just about spreading that awareness and getting more devices out there, getting, these pathways put into as many processes or in countries as possible, to support, for that confirmation and that support in quitting smoking.
okay.
Sorry.
No, I think
Yeah.
it's
Um,
a, I think that's you've given me some re good research ideas, Edward.
yeah,
So
Yeah.
just taking note of some of them, and I was just thinking, oh, that's doable,
yeah,
useful,
Yes, the
something
second
I'll look
hands
into.
smokers, isn't it? Yeah,
Yeah.
right. For these like women,
yeah,
well, so it's right. Yes, we can actually go into that.
yeah. I think we look at the traditional methods as well, maybe looking at how they, you know, how did we used to, what sort of measuring tools were there before blowing into a machine and getting a result imminently? And I think cotinine was the previous method, wasn't it, guys? But
Ah,
which is
yes.
it's a urine test, no one wants to do a urine test for many reasons. Um, but also having
Mm,
to wait for your results and things like that as well. Laboratories don't want it. It's work rebooking patients and rebooking. There's quite a lot more involved in it, and this is just the new age. This is new technology and science backed, product to support these patients. How do you see? Are there any other methods out there in helping people to quit smoking? Do you think? How if I put it, how could you compare other traditional methods alone? I guess I've kind of
Yeah, I think
touched on it.
right. Just now we
Hmm.
have touched on this.
Yeah.
So the traditional conventions, right, education methods is
Hmm.
like lectures,
Yeah.
pamphlets, right. We probably will ask them to let them to see a lot of like horrible pictures and all that kind of things.
Hmm.
But like I say, they never think that that is theirs or that could actually happen to them. So
Mm,
right. So seeing a real-time carbon monoxide readings, right, definitely can significantly
mm,
strengthen the motivations to quit smoking because
right.
it's a real time and it's like on the spot, like
Yep.
evidence. So seeing one's own carbon monoxide right level, especially I know right, Bedfont right, smokerizer have color coding. So it's like
Yes.
they have this green, then
Yes.
it go to like yellow, then it go
Yep.
to red, and they have
Yep.
this beeping sounds. It's
Screw.
really like triggers
Yes.
lots of surprise or concerns. So it's especially if they think it's higher than expected. Because I heard a lot
Yes.
of smokers right, saying that, oh, right, the level right won't be high, it will be just
Yeah.
like 15 and all that. And then it showed out right,
Surprise.
40. And then the
Yes.
beeping sounds won't stop at all. So this surprise will always generate a very powerful emotional response. So they will
Yeah.
be like disbelief, and then try to they even have guilt, and then try to of course right they would ask you try to what's your they do now. It's like, my reading now is already 40. So the doctors, well, do you have any ideas and, to help me in these situations? So such an experience definitely is harder to replicate, right, through the passive
Mm,
methods, right, like
right.
posters,
Yeah.
group talks, because we don't have the X-ray eyes. We can't
I got
see
you.
what's
Yeah.
mouth, right?
Hmm.
The one that right, I think can do that, right, is probably dentist because once
Right.
the person open the mouth, they can know that, right?
Can see.
What is the, inside their mouth, and they will
Yeah.
say that, right? Yeah, it's like this.
Yeah.
You have decay it's because of your smokings and all that.
Yeah.
However, it is still not powerful,
No.
right? I think it's still not powerful. So it's right,
Yeah.
with smokerizer, that kind of like settings, right, were actually right,
Hmm.
much more right, stronger emotional impact for the
Hmm.
person, right, who use it.
Well, I mean, I think we've gone over everything that we wanted to cover, I guess, and during our with this discussion on World No Tobacco Day. Well, I guess that concludes it. So thank you guys, and for me, it's an absolute pleasure to see you again, and learn
You,
more,
David.
and yeah, very welcoming and positive. Thank you.